Yes, hello everybody. I've decided to make a brief video on some of the subjects that we covered at the end of chapter 3 that might be a little confusing or that you may have missed. So I'm going to be covering hypersensitivity reactions and immunodeficiency. So here we go. Okay, hypersensitivity reactions. So the reactions are basically going to be due to antibody or cell-mediated causes. And this relates back to the dysfunctional B or T lymphocytes, because they are the ones that ultimately are involved. So the categories that will be covered are immune situations, unusual responses to pathogens, and the same for responses to environmental agents. So hypersensitivity reactions are excessive secondary reactions. They occur after the primary or first exposure. So we have we have 4 types. We have 3 that are involved with the B cells and therefore their antibodies. So that's type 1, type 2, type 3. And then we have the 4th that is occurring because of dysfunctional T cells. So type 1 hypersensitivity, and this is due to IgE. So what we see is the typical allergic response. So hay fever, asthma, and even anaphylaxis. IgE is produced against a non-pathogen, so that could be pollen, cat hair, dust, peanuts, that sort of thing. So the IgE that's produced will attach to the mast cells, and that is through the Fc region that we learned about earlier. When the IgE binds to the antigen, you get an instant histamine release, and therefore you get inflammation almost instantly triggered. So this can result in either local or systemic reactions and vary from being mild to very severe in terms of the symptoms. And just a chart that goes through this a little bit. You see here the pollen. This is the triggering antigen. You get a plasma cell that makes antibodies against the pollen. The antibodies, and these are IgE antibodies, attached to the mast cell. Re-exposure to the pollen, they attach to the IgE, and then you get the histamine released, and then you get edema and the rest of inflammation occurring. And here's a picture of anaphylaxis. This is obviously the most severe situation, and this person should have some medical help to get through this. Hypersensitivity type 2. So here we're talking about autoantibodies. So they're antibodies that are generated against our own self tissues, host cells. So why does this occur? Well, there are 4 reasons. 1, you could have basically a mutation of the B cell that now makes that B cell create these defective antibodies. You can have autoreactivity. So here are B cells that have not been eliminated through central tolerance. They have survived a process that they shouldn't have. And so they get out into the body, and then they can create antibodies that will attack the host cells. Mimicry. This is where we have a cross-reactivity situation. So the pathogen and the host cell tissues are just too similar, and the antibodies that do react against the pathogen also react against host tissue. And finally, we have hapten targeting. So haptens are very small, tiny antigens, and they get attached to host tissues when they enter the body. And so this combination is recognized as being pathogenic. So the host tissues are attacked as well as the antigen. And what happens in all of these situations? Well, you have one possibility where you have extensive tissue destruction, because the attached antibodies may be able to activate complement, which will get the immune response going. That inflammatory response is the release of a variety of substances that can cause that tissue damage and death. The other possibility is that you have altered function, and in this situation, the antibodies attach to the cell receptors or their ligands, and therefore they will disrupt normal host functioning of these cells and glands, tissues. So here is type 2 sensitivity. Here we have complement activated, the immune response, which is resulting in death of the cell, necrosis. Here we have a target cell where we have antibodies that have attached inappropriately. And so this creates a situation where the regular host cell is now considered as foreign as a pathogen. So type 2 diseases. So situations where cells or tissues are the targets and where the damage are caused. Hemolytic anemia, this is where the red blood cells are the targets. Goodpasture syndrome, here it is the collagen located in basement membranes of the kidneys and lungs. So unfortunately, you can get severe situations, renal failure, pulmonary hemorrhage. Altered function, Graves' disease. Here the antibodies actually stimulate thyroid cell receptors, and that will cause excessive hormone secretion. And then you have a case of myasthenia gravis, where the antibodies block receptors. And so in the case of those receptors being on muscle cells, there will be no neural stimulation occurring, and then that will result in paralysis. In this video, it is posted. Wendy Williams is the talk show host, and Graves' disease is that problem with an overactive thyroid due to an autoimmune condition. So type 3 hypersensitivity, again, this involves antibodies, antigens. This time they are forming clumps the way they are binding together. And so these clumps are the problem. Clumping is actually agglutination, and it is actually a normal immune process. So these complexes generally just circulate routinely through the bloodstream, and then they are screened out by macrophages that are located in the spleen and liver. So again, this is a normal occurrence and something the body is very capable of handling. However, problems develop if the host is experiencing an overwhelming or persistently long infection, or you have self-antigens, autoimmunity being created, being recognized. And complexes and antibodies in those cases can settle on the tissues. So as long as these complexes are circulating, they're fine. The minute they settle on tissues, that's where you get tissue damage. And so you get your typical inflammatory response, complement is activated, and you get the tissue necrosis, which can be local or occur actually systemically. And this chart just shows the process. So type 3 diseases, well, lupus is one, systemic lupus erythematosus, and a very severe autoimmune disease with damage to multiple organs, especially the kidneys, joints, and skin. Another disease is called post-streptococcal glomerulonephritis. So here you have an inflammation and damage occurring to the glomeruli in the kidney because the antibodies that are created to fight strep infections like a strep throat actually cross-react, and there's too much similarity between the tissue in the kidney and in the bacteria that are causing the initial infection. So this is a strep infection complication. You end up with a lot of tissue damage. And then you have polyarthritis nodosa, and here the complexes are settling in the arteries. So you get damage to the vessel cell walls, a lot of erosion, so you can have blood leaking out, and damage can also result from ischemia because you're not getting enough blood going to various organs that need that oxygen. And this is just a slide that shows polyarthritis nodosa. And here you can see the complexes are settling on the vessel walls. Complement is activated, that brings along the neutrophils, so you get your inflammatory response, and then you get damage to the cell wall. I'm sorry, the vessel wall. lupus. So here we have Selena Gomez, and she has both type 2 and 3 disease. And again, all of these different places in the body are affected. The video goes into greater details, so be sure to watch that. And then we go to hypersensitivity type 4, and this time we have the T cells that are the culprits. By the way, this is a picture of poison ivy. And those of us who are allergic to it know exactly what type of rash that creates. Very uncomfortable. So this time we have a cell-mediated response. There are no antibodies involved. It is strictly because the T cells are not normal. They're not doing what they should be doing. They're causing damage. So the first exposure results in activation of the naive T cells. And so you get memory cells produced. And the second exposure, those memory cells are activated. This is also known as delayed onset hypersensitivity. So it takes 2 to 3 days for the symptoms of this to actually become apparent. And this is due to the time that is needed to reactivate the memory T cells. So type 4 responses, there are 2 types, and it is based on the T cells that are involved. So T cells that are reactive to chemical substances, or T cells that are reactive to pathogens. So with a chemical response situation, you have the T killer cells, the CD8 cells involved. So they are the ones that react abnormally to non-allergenic substances. And this time we're dealing with chemicals or metals. So soaps, poison ivy, nickel allergies, latex, etc. And in this situation, these particular antigens are very tiny. So they are absorbed as haptens. So they become attached to the host cells, and that combination is mistaken for a pathogen. So what happens? The antigens, those little particles, pass through the skin, and they travel to the basal cell layer. So that is the layer between the dermis and the epidermis. So these basal cells absorb these small little chemicals, whatever, and they present them as an antigen on the MHC1 receptors. So don't forget, MHC1 are linked to CD8 cells. Those are the killer cells. So the memory T killer cells are activated, and then they attack the basal cells. And then this again stimulates the inflammatory response. So you get cell death and tissue damage right at that layer, that basal cell layer. So you do get a rash, you get sort of blistering, and again, another very uncomfortable situation. So here you see contact dermatitis. This is probably due to exposure to poison ivy. You can see the type of rash. And here you see it looks like ulceration here of the earlobe, probably caused by a nickel allergy in the jewelry that this person was wearing. So the pathogenic response involves the T helper cells, the CD4 cells. And what happens is that because of an excessive response, they are involved with the granuloma formation. And we've talked about granulomas in my past 2 lectures already. So remember, the granulomas form because there is a persistent pathogen that the body is unable to eradicate. And typically we see that in TB, syphilis, and various fungal infections and some other situations. So here again, we have activated memory T helper cells, macrophages, and other lymphocytes involved. And you get that nodule. In the middle, you have your necrosis occurring, that caseous necrosis. Then you have all these other immune cells surrounding it, and you have just a situation of chronic inflammation and tissue damage. And then here you can see what's happening. You have your pathogen. You have your pathogen here in the center, these little blue dots, whatever pathogen that's supposed to be. These are initially digested and not eradicated. So you end up with the caseous necrosis occurring in the center. Here you have your macrophages. And what we call a giant cell, which is a differentiated macrophage. It's a fusion of 2 or more macrophages, and you can still see there's pathogen inside of them. They have not been eradicated, and then around that you have your lymphocytes, your T helper lymphocytes especially, that are involved in stimulating this to keep going, and you end up with your typical granuloma. So it is doing something good for the body in that it is containing the pathogen and keeping it from spreading, but it still is a hypersensitivity reaction. And here's an example of what we call a syphilitic gumma. So this is caused by syphilis. Here's a very large node. As a matter of fact, this size is called a tumor. And so this has all of the caseous necrosis and all the cells that we just spoke about all inside of this. And if you look at the next slide going over, the one to the right, you can see the palate looks back to normal. And this is what will result with proper treatment. Usually antibiotics will do that. So how do we remember these various hypersensitivity reactions? Well, use the word react, R-E-A-C-T, and we will take this is sort of a mnemonic, we will take this and break it down. So the R stands for react, the E will stand for IgE, so this is the type 1 reaction. A stands for antibodies, that's the type 2 reaction. C is for complexes, so we have those immune complexes that are settling out onto the tissues. So this is the type 3 reaction. Remember that all 3 of these are because of dysfunctional B cells. And then finally, we come down to T for T cells. So this is the cytotoxic type of, and cytotoxic and T helper cell type of origin. So moving on to immunodeficiency. Why am I always sick? Well, something's wrong with the immune system, and that could be a variety of things. So basically, something's missing or something's dysfunctional with the immune cells. So when this happens, you will have either reduced numbers of immune cells and or needed antibodies. So the effects of immunodeficiency can vary, and it really depends on what is missing. So is it a specific cell type, or is it an entire immune system or branch of an immune system? So variety of symptoms, minor illnesses are frequent. Opportunistic infections, which are caused by normally non-pathogenic organisms, are common. And also, if this is a severe condition, so there's a lot missing here out of this immune system, you will get very serious illnesses and or death. So there are disease types. We have primary deficiencies and secondary deficiencies. So primary deficiencies are those that are congenital, so they are present at birth. And what you see is a block in T or B cell development. So you're missing major cell types here. The most severe of these deficiencies occur when you have a stem cell defect. So think back to our chart and think back to what would happen if the progenitor of the lymphocytes were defective and not performing properly. You might not have either T or B cells. That could be a very devastating situation. So this is called severe combined immunodeficiency, or SCID. And it is, again, what you're born with. So infants, young children, you would see early death. And really the only way now to treat this problem, because it is a genetic problem, is to treat it with either a bone marrow or stem cell transplant. They are working on trying to do some gene editing with these problems, where they go in and they will remove a defective gene or put in a good gene. But this is still in the research phases and not accepted treatment yet. It hasn't been completely refined. Secondary deficiencies, these are more commonly seen, and they are an acquired suppression. So you're born with a normal immune system, but something happens that changes that and causes some sort of deficiency. So it can be unintentional. Prime example of that would be infections. So HIV, Ebola, even the COVID virus can cause initially a suppression of the immune system. COVID virus likes to go after the CD8 cells, the killer cells, and those numbers really fall, sometimes dramatically initially, certainly. Other sources of deficiency could be various cancers, accidental radiation, excessive radiation, or chemical exposure to toxic chemicals. Intentional deficiencies, so these are done on purpose to create suppression, and they are used for treating or preventing certain diseases or situations from occurring. So in terms of treating diseases and conditions, autoimmunity, cytokine storm, cancer, these are all examples where you can have an overactive immune system, and so you need to suppress that and again cause a intentional deficiency situation. Also preventing transplant rejection. So transplants, unless it's from an identical twin, will always result in some form of rejection. If the match is not a good one, you will can almost get immediate rejection. If it is a very close match and there's just a few things that are not quite good enough, you will have rejection occurring, but at a very low, almost undetectable level. So again, especially initially when these transplants are done, you do want to suppress the immune system so that they are not immediately rejected, or sometimes medications are taken over a long time to prevent it from happening. And then here is a video on SCID. This one takes place in Indiana. It involves a young child. And what I will mention is because they didn't test for immunodeficiency in newborns, until recently, this child had SCID. But fortunately, now in all of the states here in the United States, babies are being tested for this, because the sooner the problem is identified, the sooner there is hope through treatment. And then we have AIDS and HIV. The reason why this is a topic in this chapter is because, as I mentioned, this is a form of immunodeficiency. As a matter of fact, without any treatment, certainly you will die because all of your T helper cells are wiped out. So this lecture is actually on a separate video that is also posted online. So please go to that to finish this chapter. And that does complete things. So I will say goodbye for now, and I will see you in class next week for your midterm and a lecture on I'm getting a blank here, on neoplasia on cancer.